Welcome to the Healthcare Personnel Safety Component Training Session for Long-Term Care Facilities. My name is Lydia Tekla, and I work with Jolie Siegel in the Division of Healthcare Quality Promotion at CDC. Today, we will review the Influenza Vaccination Summary of the Healthcare Personnel Vaccination Module. The objectives of this presentation are to review some key points on how to complete annual flu reporting, go over steps on how to get started in the healthcare personnel safety component, and review frequently asked questions. Before we go further into the presentation, as a reminder, the influenza vaccination coverage among healthcare personnel measure was finalized in the final rule linked in this slide. If you have any questions, please contact CMS at the address on the slide. Beginning with the 2023-2024 influenza season, facilities will need to report annual healthcare personnel influenza vaccination summary data. These data are reported through the NHSN Healthcare Personnel Safety Component in NHSN. Please note that reporting weekly flu data does not satisfy the CMS requirement. Please note that if you have not already done so, facilities must activate the Healthcare Personnel Safety Component in NHSN to report annual influenza vaccination summary data. Only the NHSN facility administrator can activate a new component. If the facility administrator has left the facility before transferring their role, please complete the administrator change request form linked on this slide. When adding the HPS component, do not deactivate any other NHSN components, such as the LTC facility component. Before facility administrators can activate the HPS, they must request Level 3 access if they do not already have it. This can be done by sending an email to NHSN ServiceNow with the subject line, SAMS Level 3 access. In the email request, that Level 1 access be removed and replaced with Level 3. Make sure to not deactivate any other NHSN components. A final key point is when to report. The reporting period for the 2023-2024 influenza season is from October 1st, 2023 through March 31st, 2024. Facilities are required to submit one report covering the entire influenza season. So, in other words, weekly or monthly reporting is not required. The deadline to report the annual healthcare personnel influenza vaccination summary data through the NHSN HPS component is May 15th, 2024. NHSN will then transmit the data to CMS. We will also reinforce these points as we go through this presentation, as we will review the data facilities will need to collect, how to enter data, and how to run data analysis reports. The next slides provide an overview on how to get started in the HCP vaccination module of the HPS component. First, we will go over some key roles in NHSN. The NHSN facility administrator is the person enrolling the facility in NHSN. They are the only person who can activate additional components for a facility, add, edit, delete rights to facility data, users and users access, nominate and join groups for data sharing, and is the only person who can reassign the role of facility administrator to another user. There can only be one NHSN facility administrator per facility. Users have the ability to view, enter, and analyze data, but these rights are determined by the facility administrator. Users may also be given administrative rights. It is recommended that each facility have at least 2 NHSN users. One of these users should have NHSN facility administrator rights. This slide covers some key points on what facilities can do if there's a change in facility administrator. NHSN facility administrator should transfer their role to another user prior to leaving the facility. However, if this does not occur, NHSN can add an individual as the new NHSN facility administrator if the previous NHSN facility administrator has left the facility. In these cases, please do not re-enroll the facility in NHSN. Instead, please complete the NHSN facility administrator change request form linked on this slide. After being assigned as the new NHSN facility administrator, the individual can then begin the new NHSN user onboarding process. To tell whether you have level 3 access, you can compare your interface to those in the screenshot above. As you can see on this slide, the level 1 interface is gray and the level 3 interface is blue. As previously mentioned, the first step in entering annual flu data is requesting level 3 access if it has not already been granted. Facilities administrators will need to send an email to NHSN ServiceNow with the subject line, SAMS Level 3 Access. In the body of the email, facility administrators will request that Level 1 access be removed and replaced with Level 3. It usually takes between 1 to 2 days for the help desk to add Level 3 to the user's profile. Once you are approved, you will log into the application as seen in this screenshot by selecting NHSN reporting, not long-term care reporting. Please note that you only need to activate the HPS component once. To see if your facility has activated the HPS component, navigate to Facility, Add Edit Component, and see if the box next to the healthcare personnel safety is checked, as shown next to the letter A on this screenshot. If it is, then the component has already been activated. If the facility administrator has also accepted the agreement to participate and consent, as shown by the 2 here, you are ready to report annual flu data. Once Level 3 access has been granted, users can activate the HPS component. Please note that this component only needs to be activated one time. Facility administrators will log into the LTC component and navigate to Facility, Add Edit Component. Facility administrators will then scroll to Components Followed and check the box next to Healthcare Personnel Safety. An alert will pop up indicating you must first define the primary contact for this component. Click OK. Enter the contact information on the next page for your HPS primary contact. Note, this can be an existing NHSN user. To log into the HPS component, first log out of the application, log back into the application, and select the Healthcare Personnel Safety component to activate the Healthcare Personnel Safety component. After submitting and updating this information, your facility administrator must return to the NHSN homepage and log into the HPS component to accept the agreement to participate and consent. Once rights are accepted, your facility is ready to submit data to the HPS component, including annual influenza vaccination data. Be sure to scroll all the way to the bottom of the page and click the Accept checkbox.
Now go over entering data for the HCP Influenza Vaccination Summary. This slide shows the steps facilities take to access the HCP Influenza Vaccination Summary form after they have activated the HPS component. This is what facilities will see on their screen in NHSN when adding influenza vaccination summary data. You must complete all fields marked with an asterisk on this page. Influenza and seasonal are the default choices for vaccination type and influenza subtype. Do not change these. The user would then select the appropriate flu season in the drop-down box. For example, if you are reporting data for the 2022-2023 influenza season, you must select the 2022-2023 in the drop-down box. Once you have completed data entry, save the data by clicking the Save button at the bottom of the screen. For each update of the influenza vaccination summary data after the initial entry, you will see a message at the top of the screen indicating that a record of the summary data already exists. The date last modified shows when data were last entered and saved. Facilities can also add data via CSV upload. They can do this by following the same pathway as described previously and then clicking on Upload CSV. CSV template files and instructions can be found on our webpage. Look under the CSV Data Import heading and under the Annual Healthcare Personnel Flu Vaccination Data subheading on the webpage. We will now go over how to confirm data submission. First, generate datasets by navigating to the location as seen in the screenshot. You will go to Analysis on the left-hand side, Generate Datasets, and then Generate Reporting Datasets. The next step is to run a CMS report. The location of these reports are seen in the screenshot. This slide shows what the output of the reports will be. The highlighted section shows that annual flu data has been submitted for the 2023-2024 flu season. Now we will take the time to review some commonly asked questions. The first question is, what data are submitted? The reporting period for the 2023-2024 influenza season is from October 1st, 2023 through March 31st, 2024. Facilities are only required to submit one report that covers the entire reporting period by May 15th, 2024. Monthly reporting in NHSN is not required. However, facilities are encouraged to update healthcare personnel influenza vaccination summary counts on a monthly basis so the data can be used to inform influenza vaccination activities at the facility. The second question is, why is there no option to complete a monthly reporting plan? As of 2022-2023 influenza season, the monthly reporting plan is no longer required to complete prior to entering annual healthcare personnel influenza vaccination data. Another question addresses why you might not see the HPS component even though you already have Level 3 access. Once you have this access, you must make sure that you are logging into the NHSN reporting, not the other options seen in the screenshot. Another question asked if there is a resource that reviews how to add the HPS component. The answer is yes. There is a resource that outlines how long-term care facilities can add the HPS component, and it is linked on this slide. The next question is, what code should I use for the flu vac loc field when I upload CSV files? For this field, please use flu hosp. This is the code used by most facilities. We understand this has caused some confusion in the past. Some users have received emails warning them that their data has not been submitted. We recommend that users check the dates referenced in any emails that they receive. If they reported data on or after the date referenced in an email, the data you reported would not be reflected in the email. We also advise that facilities verify their healthcare personnel influenza vaccination data submission by following the comprehensive instructions outlined in this document. And finally, there are other resources that facilities can review on data reporting. Some of the key resources are listed on this slide. We will now go into more detail on the resources. Facilities can visit the NHSN website using the link on this slide. The website contains links to the protocol, data collection forms, table of submission of instructions, frequently asked questions, and training slides for the HCP Influenza Vaccination Summary reporting. If you have any questions about NHSN, please send an email to user support at nhsn-servicenow. You should also include HPS flu summary in the subject line of the email and specify that you are a long-term care facility. This concludes the presentation. Thank you so much for your time. We will now have the opportunity to answer questions.